Hello. Thank you for joining us to learn more about your joint replacement surgery at Sentara. In this video, we will be covering knee and hip replacements. You will learn how to prepare for surgery, what will happen on your surgery day, and what happens after surgery. This will include some discussion on pain management and how to reduce complications, as well as some exercises to begin before surgery that will build muscle memory and help with your recovery. First, let's talk about knee replacement. A knee replacement removes damaged bone and cartilage from the thigh bone, shin bone, and kneecap. Then, an artificial joint, which is known as a prosthesis, is inserted. Cartilage is a tissue that covers the surface of a bone at a joint and helps reduce friction and absorb shock. When the cartilage breaks down or is damaged, it can cause bones to rub together, creating pain in that joint. Now let's talk about hip replacement. Your hip joint is unique. It is known as a ball and socket joint. In a total hip replacement, your surgeon will replace both sides of the joint as well as the cartilage with an artificial joint, also a prosthesis, like the one shown here. In addition to your surgeon, your care team includes a patient navigator who will be your primary point of contact and can answer questions about your upcoming surgery. Ask your surgeon's office for more information about how to reach your patient navigator. Another important part of your care team is your coach. A coach can be a family member or close friend who plays an important role in your care and recovery. Coaches provide you with support at home after your surgery and should be available to assist you. Please make sure you assign a coach prior to surgery. We will provide them with the coach's checklist at the hospital. Another valuable resource is our patient and family guidebook, which you can download online at sentaraorthoeducation.com or scan the QR code on the screen. The guidebook contains exercises, a medication list, what to expect before and after surgery, and how to prepare your home for your recovery. Review the entire guidebook before surgery, and then use it as a resource throughout your recovery. Before your surgery, you will need to have a medical clearance exam. This is required before any elective surgery, and the goal is to be sure that any other medical conditions you may have are well managed. This exam can be done by your primary care provider, your surgeon's office, or through the pre-anesthesia surgical screening or PASS clinic. During your medical clearance exam, your past medical and surgical history and your medications will be reviewed. Discuss pre-op instructions with your surgeon's office. Regardless of how your medical clearance exam is conducted, you will receive instructions on when to stop or change medications, like Coumadin, aspirin, non-steroidal anti-inflammatory drugs or NSAIDs like Motrin or Advil, as well as other medicines such as Plavix, fish oil, and herbal supplements. Coumadin, aspirin, and Plavix are all anticoagulants or blood thinners. If you take these medications, you will be instructed by a physician when to stop taking them. If you are taking vitamins or supplements, you should discuss all of these products with your provider before stopping. Typically, you will be instructed to stop taking vitamins, fish oil, and herbal supplements 7 days prior to surgery. Prepare and review a medication list before surgery. Take time to make sure you include prescription medications, over-the-counter medications, supplements, and natural herbs, including patches, creams, drops, etc. on the medication list. You can also check your Sentara MyChart and make sure all your medications are current. It is very helpful to your admission process and direct patient care at the hospital. There is a section in the guidebook where you may write down your current medications. Don't forget to bring your medication list in with you on the day of surgery. You will need to stop taking NSAIDs such as Motrin, ibuprofen, Aleve, naproxen, and Voltaren 7 days before your surgery to prevent increased bleeding after surgery. To be cleared for your surgery, you will need to get blood work. You may also need an EKG, chest X-ray, or other testing. We will prepare your surgical site at the hospital, so please don't shave, clip, wax, or use chemical hair remover on or near your surgical site 3 days before your surgery. That is, your face or neck if you are having surgery on the cervical area of your spine. If you come to the hospital with red, raised, irritated, or broken skin, your surgeon may cancel and reschedule your surgery. We also encourage you to get familiar with your insurance coverage now, instead of waiting until after surgery, so there aren't any surprises. Benefits for home care, equipment, and other coverage vary widely, and in some instances, your insurance may not cover any portion of these expenses. Your surgeon's office is a good resource. You may also call the Sentara estimate line at 757-233-4605. Make sure you know the procedure code and allow 24 hours for the team to collect information for you. Don't forget to make a plan for after surgery. Make sure you have transportation home and plans for someone to help you at home for at least the first 24 to 48 hours. These plans need to be made before you come to the hospital for surgery. The night before surgery, your preparation for surgery begins. Be sure that you remove fingernail and toenail polish. You may leave clear polish on. This is necessary to check for capillary refill and measure your oxygen content using a pulse oximeter. We want your skin to be clean prior to surgery. You will be instructed on how to conduct your pre-surgical cleanse the night before surgery and again in the morning. This shower is part of our skin decontamination protocol. You will receive specific showering instructions from your care team. Please follow them carefully. You should avoid the genital area and the face. Pre-surgical skin cleansers can cause skin irritation in those areas. Use a clean, non-cotton cloth or your hands to wash with the cleanser. When it comes to food and beverage leading up to surgery, eat a regular meal in the evening. You will be given more specific instructions about eating and drinking before surgery. Please review these instructions and follow them carefully. As part of our Enhanced Recovery After Surgery, or ERAS protocol, you may be instructed to drink a carb-loading beverage the morning of your surgery. Please review and follow the instructions carefully. If you have any questions, please reach out to your surgeon's office or patient navigator. If you are a smoker, do not smoke for 24 hours before your surgery. As mentioned before, in addition to your shower at night, you will also take another shower with the skin cleanser on the morning of surgery. When you get dressed, please wear clean, comfortable clothes to the hospital. All jewelry, rings, earrings, and body piercing must be removed prior to going into the operating room. It may be necessary to cut rings off if unable to remove. Please bring these items with you when you come to the hospital: your insurance and identification cards, a current list of medications, a payment method in case your prescriptions have a copay, containers for glasses, contacts, hearing aids, dentures, or any other items you may have. The rule is simple. If it comes off at night and fits in a container, please bring the container. This will help us keep track of your items so they don't get lost or broken. You should also bring loose, comfortable clothing for your return home. If you're having knee replacement surgery, bandaging is quite bulky, so it is better to bring shorts instead of pants. We also recommend shorts or pants with an elastic waistband. While in the hospital, you will wear anti-slip socks for safety. If you want to wear shoes home, make sure to bring a supportive pair, not a slide or a clog style. Lastly, if you use a CPAP machine, please bring it and know your settings. We will provide the water if your machine requires it. When you arrive at the hospital on the day of your surgery, proceed to registration first, where you will be directed to the pre-op area. Once in the pre-op area, You will be given antiseptic skin wipes and instructions how to use them before changing into a hospital gown. Your pre-op nurse will review medical history, medications, and allergies, take vital signs, check height and weight, start an IV, and swab the inside edges of your nose with a specific antiseptic solution. You may also receive pre-op medication. You will receive IV antibiotics. Studies have proven that a dose of IV antibiotics before a surgical procedure decreases the potential for postoperative wound infection. Meeting your anesthesiologist is the next step in your pre-op process. They will again review your medical history, past surgeries, and discuss choices available for your anesthesia. General anesthesia causes a total loss of consciousness. You will have a breathing tube placed, and you will be connected to a ventilator. The machine will ventilate you with a mixture of anesthetic gases and oxygen. If you receive spinal anesthesia, an anesthesiologist will insert a catheter between your vertebrae. This reduces all sensation, so you won't feel pain during your surgery. With spinal anesthesia, you will also be given medication so that you are not awake during your procedure. We use IV medication similar to what you receive during a colonoscopy. You will be completely unaware of what is happening. If you are having knee replacement surgery, you may be offered a nerve block. Your anesthesiologist will perform this procedure. To make the nerve block more comfortable for you, your nurse will administer IV sedation. The length of time that pain is decreased depends on the specific block that is placed. When your surgery is done, we will move you to the post-anesthesia care unit, or PACU. You will spend time there as you wake up from your anesthesia. Now let's talk about pain management, what we can do to help you, and what you and your coach can do. One of our tools is the pain scale. This is a 0 to 10 scale where 0 means I feel no pain and 10 is the worst pain possible. Please take a minute to look at the pain scale. You will see that 4 means you're comfortable. If pain is keeping you from sleeping, having a conversation, and efforts of mobility, that is level 5 or above. Feeling pain at that level will be disruptive to therapy, so we want to take steps to better manage it. For us to address your pain, we need to hear honestly how the treatments are working. Our goal is to manage your pain instead of letting the pain get ahead of you. Post-op pain can't go away completely, but we want you to be able to eat, sleep, and be mobile. To manage your pain, we use multimodal pain therapy. This means a mix of pain management modalities, such as narcotic and non-narcotic medications. Part of the education you receive in the hospital is about new medicines and side effects. Constipation is a common side effect after surgery from pain medication. Here are some other ways we can help you manage pain. We will give you gel ice packs or a refillable ice pack. They are yours to keep. Please take them home so you can use them as directed. We suggest you use them frequently in the days following surgery. It may sound surprising, but walking will help to alleviate pain. Staff will be with you when you are standing or walking at the hospital. No matter how strong you feel, you should never be out of your chair or bed without hospital staff present. Our goal is for your recovery to be as smooth as possible, so let's discuss some potential complications and how we will work together to reduce them. Blood clots are a potential complication after joint surgery. Deep vein thrombosis, or DVT, occurs when a blood clot develops in the legs. It can occur during or after hospitalization and can occur in either leg. Signs and symptoms of deep vein thrombosis include redness or tenderness in your calf, a calf that's red or warm to the touch, and swelling or pain in your calf or groin area. Notify your surgeon if you experience any of these symptoms. pulmonary embolus, or PE, is a type of life-threatening blood clot. This happens when a blood clot travels through the body and lodges in the lungs. This prevents the lungs from getting oxygenated blood and nutrients. The signs and symptoms of a pulmonary embolus are shortness of breath, chest pain, and feeling anxious, like you know something is wrong but you can't put your finger on it. Call 911 if symptoms occur while at home. You need to get medical attention and a clear diagnosis as soon as possible. So let's talk about preventing blood clots. TED hose may be ordered by your surgeon. If your surgeon wants you to wear these, we will provide them for you. We also recommend ankle pump exercises. Let's give it a try now. Put your feet flat on the floor. Leave your heels in place and alternate pointing your toes up toward your head, then point your toes down, pointing and flexing your feet as far as you can in each direction. You should feel the muscles of your lower leg contracting. You can also do ankle pumps while lying down or sitting with the legs elevated. This will exercise your calf muscles and improve circulation, reducing your chances of a blood clot. Walking is important and must be done safely. Sequential compression devices are used in the hospital on both of your legs. They are a 3-chamber device that wraps around your leg. One chamber at a time inflates to help move blood back to the central circulation. Then they deflate, and the cycle begins again. Another way to prevent blood clots is through the use of anticoagulation medications prescribed by your surgeon. Some examples include Coumadin, Xarelto, and aspirin, which come in a pill form, or Lovenox, which is an injection. Your surgeon will decide which of the blood thinners is best for you. While you're at the hospital, you will be given education about these new medicines and side effects. Now let's talk about other complications and strategies to reduce your chances of developing one of these after surgery. An incentive spirometer is a device you will use to help open the base of the lungs and prevent pneumonia. We would like you to do this 10 times an hour for every hour you are awake postoperatively, in the hospital and at home. While you are in the hospital, we will also check for signs of infection and monitor your vital signs frequently. Hand washing is the most important way to reduce the spread of germs and prevent infection. There are medications available if you feel nauseous or experience vomiting. Your care team will use several options to address constipation while you are in the hospital. Use these tools when you go home as well, such as taking a stool softener, eating a high-fiber diet, and increasing your fluid intake. These methods will help decrease your chance of constipation. Getting up and being mobile or ambulating frequently will also help prevent constipation. Now let's talk about preparing for your return home. We recommend you start looking around your home for any obstacles, such as rugs or extension cords, that could be a hazard when returning home from surgery with your walker. Other obstacles could be the base of a wide chair or legs of a table that stick out. You should also watch for uneven surfaces, floors that are different levels, such as a rug to tile, or other height changes. It's also a good idea to put a night light between your bed and the bathroom in case you have to get up in the middle of the night. If your home has stairs, you will practice with a therapist prior to leaving the hospital. To help, make sure to know how many stairs you have and take note of things like the placement of handrails. Are they close together, further apart, on the left or the right, or both? Also think through and plan the best way to get into your house. The safest way may not be through the front door. You should also have a plan to have the medical equipment needed to support you in your recovery. After you have a joint replaced, you will use a walker with 2 wheels on the front and 2 pegs on the back. This is the preferred option because it allows you to stand inside and focus on a normal gait pattern. You will progress from the walker to a cane after a few weeks. However, you may need a cane to navigate stairs right after surgery, especially if you have stairs to get inside your home. If you have a walker, feel free to bring it with you to have it checked for safety or adjusted for fit. If you do not have a front-wheeled walker, please ensure hospital staff know before you leave the hospital. Before surgery, you might also want to purchase a hip kit. This is totally optional, but many find it useful after spine surgery. It consists of 4 assistive devices. These are a long-handled reacher, long-handled sponge, long-handled shoehorn, and sock aid. These can be purchased at most Sentara to-home pharmacies or online. Now it is time to talk about pre-op exercises. These exercises were chosen because they are the most important, and you should start doing these today and continue after surgery to build strength and muscle memory. Start with 10 repetitions of each exercise, doing 2 sessions per day, and work your way up to 20 reps of each exercise, performing 2 sessions daily. While our illustrations show the person doing exercises on the floor, we ask that you do them on a firm surface like your couch or bed. Let's start with the glute squeeze. To perform this exercise, squeeze your buttocks muscles as tightly as possible while counting out loud to 5. For the quad set exercise, slowly tighten your thigh muscles of the straight leg and hold for 5 seconds. For the heel slide, bend your knee and pull your heel toward your buttocks. Hold 5 seconds, then return leg to starting position. To do a short arc quad, place a rolled towel or pillow under your knee. Straighten your knee and leg. Hold this for 5 seconds. The last exercise is quad strengthening. To do this, tighten your muscle on top of your thigh and straighten out your knee. Hold for 5 seconds. We've covered pre-op exercises, so now let's talk more about physical therapy after surgery. The therapy department is staffed 365 days a year. That includes holidays and weekends. Your first session of physical therapy is called your evaluation. If you have surgery in the morning, you should expect to see a therapist that afternoon. If your surgery is later in the day, you may not see a therapist until the next morning. Our goal is to have our patients out of bed within a few hours following surgery. During the evaluation with your therapist, they will talk with you about your home and equipment, and, as we noted a few minutes ago, they will work with you on things like getting up and down the stairs. Your coaches are encouraged to observe therapy sessions and be present for stair training if required. The therapist will determine if you need additional therapy. Once your surgery is complete and your care team feels you are ready to leave the hospital, it's time to transition home for the rest of your recovery. Our goal is to get you home safely as soon as possible and get you back to your normal activities. We encourage you to be open about how you are feeling and what challenges you may be having. Understanding this will help us better connect you to resources and even help manage your pain so it doesn't keep you from doing your exercises, attending physical therapy, and simply staying mobile. We are a team working together for your recovery. When it's time to go home, please make arrangements for transportation from the hospital. Ambulance transportation is not a covered service when you are up and able to walk after surgery, so you will need to find another means of travel. We recommend the front seat is pushed all the way back to give you more legroom. To help you get into the car safely, back up to the car until you feel the seat at the back of your legs. Reach your hand behind you for the back of the seat, using the other hand to secure a spot on the frame of the car or dashboard. The car door or walker are not secure options. However, if you need to use the car door or walker, have someone hold the unsteady objects. Slowly lower to a sitting position. Scoot your hips back until you are securely on the seat. Leading with your hips, bring one foot into the car at a time until you are facing forward. You may want to recline the seat to increase the ease of lifting your legs. You can also keep the seat slightly reclined while you are riding in the car if it is more comfortable for you. An ongoing exercise program will continue to be an important part of your recovery. The type and duration of therapy services after surgery will depend on many factors. Home therapy is when a physical therapist comes to your home to evaluate you and outline a care plan. You are expected to do exercises at home in between visits. Outpatient therapy is when you go to a designated center to work with a physical therapist. Again, you are expected to do exercises at home in between visits. Self-directed therapy is when you are given a specific set of exercises to do at home. The number of therapy visits you will receive at home or at an outpatient therapy center is dictated by your insurance coverage, your surgeon's orders, and your progress. Let's talk a bit more about caring for yourself at home and what's more important for your recovery. First, read all your discharge instructions and have your coach read them as well. They will include your medication schedule, what to take and what not to take, bath and showering instructions, and information about your surgical dressing. You should have someone who is able to assist you for at least the first 24 to 48 hours. Make sure you're taking your pain medications as instructed. Remember, we want you to stay ahead of the pain. We suggest that you get up every hour during the day. This increases circulation to reduce your risk of blood clots and exercises your lungs and helps with pain control. You will recover faster if you eat healthy foods. If you have a smaller appetite, we understand, but we ask that you still eat small amounts of healthy foods and hydrate. You will increase your walking distance over time. We suggest that you set a schedule and goals so that you can measure your progress. We know that this is a lot of information. That's a big reason why we created this video, so you could review it at your own pace and as many times as you'd like. Your patient and family guidebook will continue to be a great reference. And as always, if you have questions or concerns, please reach out to any member of your care team, especially your patient navigator. They are there to answer questions, calm your nerves, and help ensure you have the best experience possible. Thank you for trusting us. We are honored to be your partner in care.